Today I'm going to demonstrate how to insert a peripheral IV. The supplies that you will need are an IV start kit. There should be a drape, ChloraPrep, a dressing, a tourniquet in here. Make sure you read your kit so you know what's in there. A drape for your patient if your kit does not have one, a J-loop, IV catheters, I always bring 2 in the room, a flush, tape, gloves, sanitizer, and sharps. Wash my hands. Hi, Mr. Mason. I'm Jody. I'm going to be your nurse today. Can you tell me your name and date of birth? He confirms. We confirm that he has no allergies. I let him know that I'm going to be starting an IV. I don't put clean gloves on at this point. They are necessary prior to inserting the IV, but while you're assessing for a vein, you don't need them. I'm going to put a drape under my patient's arm. And my IV start kit has my tourniquet, so I'm going to open this and remove my tourniquet. When thinking about selecting a vein, you want to try and use the non-dominant hand if possible. You want to start distal and go proximal, so start at the hand and work your way up. Avoid any arms that have PICC lines, AV fistulas, if they've had a mastectomy on that side, or if they have paralysis from a prior CVA. You want to look for a vein that is straight, and when we apply our tourniquet, we're going to go 4 to 6 inches above the proposed site. When you're looking your vein, you'll feel that it has a spongy quality to it. Once you decide which vein you want to use, you want to release your tourniquet so that we're not cutting off the patient's blood supply. And then we're going to get all of our supplies ready. So to get my supplies ready, I'm going to open my start kit. I like to have everything nice and close to me. Our J-loop, you want to prime your J-loop. And you want to loosen this cap, but don't take it off. You don't want to break the sterility of the end. All right, now I'm going to put my gloves on. I want to clean the area that I'm going to be inserting the IV in. The chlorhexidine that I'm going to be using, I just squeeze to break, and then I'm going to push down to make sure it's on the pad. And I just want to clean a big area, scrub all over at least for 30 seconds, and then you want to allow time to dry. Reapply your tourniquet. Remove the cap from your IV catheter, and you want to anchor the vein that you're going to be going in with your non-dominant hand. I like to pull down into the side with my thumb. When you insert your needle, it's going to be bevel up, and you're going to insert at a 10 to 30 degree angle. Once you see a flash of blood, you want to advance 1/4 of an inch further, and then only advance just the catheter to the hub. Release your tourniquet, apply pressure above the site, and remove the needle. Grab your J-loop, attach to the end of your hub, and then you want to flush the site. Pull back and see to make sure that you have blood return, which I do. And then we can flush and clamp. Grab your dressing, apply it over the site. use your extra tape to cover the hub and the connection, and then you're going to remove your flush and anchor your J-loop. The dressing that comes in your kit has a little sticker that can be taken off, and I'm going to put my date, time, and initials on here. And make sure when you put the date, time, and initials on, you do not cover the site of insertion so that it can still be assessed. And then you'll document in the computer the site that you inserted and the gauge that you used.